Welcome back to Arista MD's third annual virtual conference, Managing Specialty Care in a Value-Based World. I am pleased to welcome Anne Lanova from Memorial Care. She is the Executive Director of Digital and Consumer Experience at Memorial Care and has quite a lot of experience with e-consults. Welcome, Anne, and I'm going to turn the stage over to you and leave, but I'll be back at the end with some questions.
I am Anne Lanova, so I am the Executive Director of Digital Consumer Experience here at Memorial Care. I need to apologize for some background noise you're probably hearing today. We're actually at an internal management meeting. It's 80s themed, so we're all getting festive and excited over here, and there is a little bit of background noise, so let me know, please, if you have trouble hearing me, and I'll be sure to speak louder or slow down. So I am excited to be here today. We have been partners with Arista MD for 4 years at least, and it's been a great journey, and I'm excited to highlight some of our experiences here today. So first, a little bit about Memorial Care. We are a four hospital integrated delivery system in Southern California. We have a really large ambulatory network that we think really sets us apart. We were some of the early pioneers in value-based care over a decade ago and have the network to support it, which has been a really fun journey to be on. We are also, being in Southern California, have a pretty competitive market, and we have around 300 employed and 2,000 contracted providers that we work with. And then we're also really fortunate, me especially in my role in digital, we have a really active venture fund so that we're able to stay on the cusp of digital in general and stay really focused and forward in that realm. So a little bit about our e-consult program. As I mentioned, this is a journey that we started around 4 years ago, even pre-COVID. And at the beginning of this journey, we were really focused on solving a few specific problems. One was just timely specialist care. We know, as most of you do, that if patients have to wait to get their specialist care, there's a bigger chance that they will not ever achieve that care. We also were really focused on downstream cost savings. I mentioned that we're really focused on value-based care, and within our medical foundation, we do see about half of our patients we're actually fully at risk for. And so that's one of the main things that drove us to e-consults is, we know that there are some downstream cost savings associated with if we can keep that care at the PCP level for that first visit, but also subsequent visits. And then the third thing is that we really heard from our PCPs that when our patients would go seek specialist care with some of our partners in the community, they didn't often hear back or get a closed loop on that plan for that patient, which was frustrating for them. And so they were really excited to keep that involvement at their level and stay really in tune with taking care of that whole patient. And so based on those goals, it drove us to look for a vendor to help support us in our goals. And we liked a lot of things about Arista, but a few of the things that they really allowed us to do immediately and have continued to allow us to do is to scale our network immediately so that any of those, if we had used our own specialist, those delays might still have persisted, and we didn't want to take that chance. And so we really liked the ability to scale that network and be able to get that really quick turnaround on those e-consults. It also gave us a reduced EHR build. You'll see, I'll get into it in a little bit. We actually did do some pretty heavy integration, but we've done this in phases. And so at first we were able to get going really quickly, really with limited time from our IT team, which as we all know can sometimes unfortunately be a blocker. But again, we were able to get things up and running really quickly and without using a lot of their time. We also really liked the idea, especially when we were starting out, We knew that our physicians and our care teams wouldn't immediately be familiar with what was appropriate for an e-consult. And so we leveraged Arista MD's team of nurses that screen those consults, pull all the information together into the chart, and submitted that. We knew that they would also be able to really quickly say, hey, you guys just submitted an e-consult for this. It's really not appropriate. I'm going to send this right back to your referrals team so that we can get that patient routed to the right place, within minutes instead of, hearing about that later on. So we like that triage ability, and it really took a lot of, it really removed a barrier with our PCPs on being creative with what they sent e-consults in for. They really have that sense of security that if it isn't appropriate, it'll come back right away. And the other thing that team of nurses does for us is takes all of that burden off of our PCPs. So again, we're into reducing barriers on all sides for e-consults. And that team of nurses that Arista MD offers is huge, that they can go through, curate the e-consult, access our patient's medical record, pull together all the relevant information for the specialist, and none of that falls to either our providers or the team that supports them. And then getting those responses within 24 hours is also crucial to our model and to the problems that we're trying to solve. So all of these things together really made Arista MD a really obvious choice for us, and we haven't looked back. And so then a little bit about how we actually structured our program. We started with employed PCPs, and then we're seeing largely commercial members. So our HMO and Medicare Advantage patients are at-risk populations that are included in this model. And so that makes up the bulk of what these PCPs see. And we made it optional. And so we didn't we didn't dictate what a good e-consult use case is or a not so good e-consult use case. We really allowed it to be an opt-in and let our providers get creative around that. So there wasn't any, forcing of hands or anything to convince them to do more of these. But what we did put in to help them realize when an e-consult is appropriate is we used some tools in Epic, and we did do this right from the get-go. So this was a little bit of our IT team's build. Is that we put in a best practice alert, which essentially notifies a provider, hey, this might be a really good use case for an e-consult. Do you want to consider it for this patient? And a lot of the reason we did that was just we are only able to offer e-consults to a certain subset of our population, really our at-risk folks, and a few more other use cases. But we didn't want our providers to be burdened with looking at the insurance, remembering if it was an appropriate e-consult use case. So this technical ad that we did, this best practice alert, made it really obvious to our providers when that patient was eligible, and they could confidently order that e-consult then and know that the patient, they wouldn't be turned away because it was truly covered in their care and under their payer. The other things that we limited it to, and then that BPA was helpful for, was if anything was urgent, we didn't trigger the reminder that an e-consult is appropriate. And then we only showed it for relevant specialties. This didn't really end up being a limiter, as Arista MD offers so many specialties. But we did things like physical therapy, we did leave those out of there. But otherwise, most referrals that our providers were submitting where they were getting that alert to say, hey, consider an e-consult. We did still see a few barriers to adoption. And over the past few years, our goal has really been to reduce these and increase the number of e-consults that we're able to do. A few of those were, we heard from our PCPs that, the added workload isn't worth it. This puts extra burden on me. And again, because we have that team of Arista MD nurses to support the upfront work of this, it really did hugely reduce that barrier for the providers. And submitting an e-consult is really no different to them than submitting a referral to an in-person specialist, except that they just get it back so much sooner. There is some extra, work to keep that care at the PCP level if that's appropriate. But most of our PCPs, they want to do that anyway. It's the right thing to do for their patient. And so This, as we've gotten into it, I think this was a perceived barrier and hasn't been that big of a deal for our actual providers. Also going into it, there was a really big concern around the impact to our specialist relationships. We have many specialists in our network. We value those relationships. And we were really worried about, what is the impact to their practice going to be? Are they going to see this big drop off? Are we going to be able to keep those relationships up between our PCPs and our specialists, that they stay connected? And again, this kind of ended up being another non-issue. The volume of e-consults wasn't so much that it actually reduced our specialist workload. And what they really found is that they're just able to focus on the things that they really need to focus on, instead of, some lower acuity things that might have hit their radar that, ended up being able to be seen at the PCP level. And we're also, one of the problems we're trying to solve is getting folks in faster. And so we've really been able to do that because some of these lower acuity things aren't hitting those specialists. So this really also kind of became a non-issue. And then the last piece is compensation and financials. I grouped these two together. I think there's really two aspects here though. On the PCP side, there is a little bit more risk that they're taking on when they're in doing that care plan at the PCP level. So we wanted to make sure, and we have compensated our PCPs within their comp structure for doing that. But then the other piece is kind of the financials for the organization. And this is where that, only being able to offer it for certain payers comes in. So we're still working and hopeful that we'll be able to expand e-consults to all of our covered plans, HMO, PPO, et cetera. We're not quite there yet, but we're kind of slowly chipping away at it. And then again, we have some system configurations that allow our PCPs to at least not have to think about it in the moment, and the system will kind of tell them what the patient is eligible for. The other piece I'll just add here that turned out to also be kind of a non-issue, or was a little bit of a surprise in our implementation. When we were initially talking about e-consults with our physician leaders, we were really talking to our leaders. And so a lot of them had been here for quite a while. They had a lot of specialist relationships, and they end up doing a lot of curbsides just because they have buddies that they know or have referred to a lot. And so they kind of looked at this and said, that'll be nice, but it's not something I see myself using a ton. But once we expanded our communication plan and got into talking to some of our newer physicians who hadn't formed those relationships yet, didn't have that kind of buddy system worked out, that's where we really heard a lot more excitement come. They're also newer in their career. They, haven't seen as many things. And so e-consults have been a really, really solid tool for them to just learn more about what they really can treat within their scope of practice. And we often hear from our PCPs that they'll do an e-consult and then maybe a few months later have a really similar case and actually go back to that same e-consult, review the notes, review the thorough recommendation from the specialist, and they're able to really take those recommendations and apply them forward to their future patient panel. So that also has been a really good benefit to our PCPs. And we actually see in a lot of cases that as our PCPs start to use e-consults, we see a really big increase in their numbers. But then over time, over a year or so, it kind of levels out and drops off. And for exactly that reason, they kind of have that knowledge now that they can go back to, and they don't need to continue to do those future e-consults for the same case. So to get through all of those barriers, we did do a few adoption techniques. So the first one was around reducing those barriers. And we did a lot of that through our Epic integration. So I mentioned that initially we had the best practice alert that would pop up on the appropriate patients and let the provider know that this was a good application for an e-consult. But we further integrated as we got into the program by adding direct ordering. So provider can just say, instead of submitting a referral to cardiology, they submit an e-consult to cardiology the exact same way, so that felt really intuitive to our PCPs. The nursing team I mentioned brought a ton of value in just reducing the burden on our staff and on our providers. We also brought in single sign-in, but single sign-on within Epic. And so what that means is that as our providers go, as a response comes back from the specialist and our team needs to do that review and take action on the recommendation from the specialist, that all pops up right within Epic. So they get an in-basket message that says, hey, your e-consult is ready. They click on a link, that window pops up with the specialist recommendation, and then they can sign off on it right from there. And as soon as they do that in Epic, that e-consult note gets uploaded directly into the EHR. So it's a totally seamless process for them, all within Epic, and has really made their lives a lot easier and made it a lot easier for them to do e-consults. The other thing that's really helped with adoption is just hearing our patient feedback. Our patients could not be happier when they don't have to drive to a specialist, they don't have to park, they don't have to take more time off work. And when they get that response the next day, their gratitude is huge. And now we even see patients that have done e-consults before. When they get a specialist referral, they're asking, why can't this be an e-consult? Let me do an e-consult again. And so hearing that validation from our patients has also really helped, spur more of these because they're just literally asking for it. And then the other thing that we looked at in addition to removing barriers was increasing incentives. And so we did this a few ways too. We've tried a few models here. When we started out, we were focused really on direct payments. And so we took, an RVU value for doing an e-consult and basically made that direct payment to our providers that were in our pilot for the number of e-consults that they did. So pretty simple, I think somewhat effective. And then eventually we moved to bonus pool funding, which is where we're at now. And this really eased the administrative burden for us, and then made it just really clear to our providers. So they're actually now incentivized to do e-consults as part of their bonus funding. And then the other thing that really helped was finding and giving a platform to a lot of our hyper-local physician champions. When we started out, we partnered with our amazing director of informatics, who's a huge e-consult user, and he's really great. But his reach, I think sometimes it helps to have someone who is directly in that clinic with all the other PCPs and can help share use cases, share things about their specific network that they find really helpful. For instance, if they have a rheumatologist who is particularly far away, we might see more rheumatology e-consults from that clinic. And so as much as we can focus on localizing that message, we found that really helped as well. Excuse me. The other thing we did around our physician champions is we have an amazing medical director. And she has been kind of a boots on the ground advocate for e-consults. And so she is in a lot of our clinical meetings with specific provider offices, sharing tips and tricks, sharing great examples, sharing really positive patient feedback. And again, just helping the clinicians and the providers understand what some really good e-consult use cases are and expanding kind of how they're thinking about them and providing some new examples to turn some light bulbs on to say, oh, I didn't think about it, using it to solve that problem. But after hearing about this with my colleague, now I'll consider doing that. So really good work from her. And we're really fortunate to have a number of physician champions on this initiative that have really helped spread the word. So this is a little bit of how our volumes have continued to trend since we went live in 2020. So we try really hard at Memorial Care not to do extended pilots, but unfortunately this was one that got us in the pandemic. There were a lot of competing priorities, and so this one we piloted for a little bit longer than we would have liked. But finally, in October of 21, we expanded to our entire employed medical group. We got Epic integration going, and then we enhanced that incentive bonus to make it really clear to our clinicians how they were being compensated for this. And that incentive bonus is also when that medical director started her boots on the ground approach. So TBD on undecided if it was her or the bonus that really took us to the next level. But as you can see here, in August, we hit 600 e-consults in 1 month, which was, the culmination of a lot of work, but was really exciting and really great for our patients. And then I thought I would just highlight here too some of our high growth specialties. So this has been really interesting to see. Again, as our network changes, our providers are using or not using e-consults a little bit more based on availability, how quickly we can get patients in. Geographically, as our network changes, again, they kind of provide that backstop. Or if there's someone who becomes particularly impacted, we see maybe a few more e-consults because we're doing that e-consult in order to get a plan of care until they can be seen in person. So we see those ebbs and flows as well. But what you see here is really an increase in a lot of our top specialties. But obviously this dermatology one stands out. We do a ton of dermatology e-consults. As soon as our providers figured out, how to take that photo using Haiku, upload it into the chart, that the team of nurses can grab that photo and send it off to the dermatologist, these exploded in a really good way. And so this has been a really good way to, again, keep our patients at the PCP level of care and out of the dermatology office. And then we see really similar trends on our pediatric use cases. I will say this is a little bit nuanced, but our pediatricians are not compensated the same way as our adult providers are. And so this is really truly all kind of word of mouth. Some of the work that our medical director is doing, et cetera, to just get the word out and get more e-consults done for our peds population, who, also we can have some really impactful delays to find some pediatric specialists in some of our geographies. So this has been a real godsend for some of those patients. And then just a note too on our overall results. I mean, we think these are pretty incredible metrics. As you can see down at the bottom, they're really out of almost 7,500 e-consults. So a pretty good, use case there. But overall, 77% of them have replaced a visit. 89% have influenced a care plan, which I think is incredible. Even if we do have to go in and see that specialist, we're still impacting the way that our patients receive care and improving that within 24 hours, which is incredible. 25% are actually resulting in a totally new diagnosis. And this star rating, I think, is really impressive, especially within our own organization. We have some high caliber providers. When we have done initiatives like this in the past, before we had Arista MD at the table, we used our own specialist network, and our average rating for those kind of more enhanced curbsides was pretty much 3 out of 5, which isn't great. And so to see this 4.9 coming from the same providers that gave their own network 3 stars is pretty incredible. We've seen some that we've been really impressed with the panel, and they've provided great care for our patients. And so then on our next steps and kind of where do we go from here? We know that we can do some work around our best practice alert. I mentioned that it's really firing for most of our consults if they're within the right payer plan. And it's really only accepted about 5% of the time. So while it's a great reminder, it's not that efficient. And so we're doing some deep analytics to narrow that scope so that we can really hit providers at the right time to say, this is actually a very good use case. You should really, really consider an e-consult instead of that kind of general alert that we have for them. And we're going to do that by focusing on some of our top specialties, top use cases, again, some good provider coaching and sharing those examples. And then the other thing that we're looking to do is actually expand this to our inpatient setting. So we know that we have some non-procedural specialties that, it might not be super easy to get them to come into the hospital to do our consults. And so we think this is a good use case to get a super quick review to help our hospitalists take the next step So we're embarking on that here in the near future and really excited for that.